Hi, I'm Dr. Bruce Chalmer. Thanks for stopping by my video today. So, you're considering hypnotherapy. Maybe you've heard about the research that shows that hypnotherapy can be an effective treatment to help you lose weight, reduce and control pain, stop smoking, relieve anxiety, and fall asleep more easily. Maybe you have a medical procedure scheduled, and you've heard that hypnotherapy has been shown to improve surgical recovery, reduce the need to repeat diagnostic procedures, and shorten hospital stays. Maybe you'd like to improve your performance in public speaking, or sports, or music, or work, and you've heard that hypnotherapy can help reduce anxiety and improve your ability to focus when you need to. All true, supported by solid research. But the most frequent question I get from people considering hypnotherapy isn't about any of those great benefits of hypnotherapy. The number one question I get is, will I cluck like a chicken? So, in this video, I'll be talking about what hypnotherapy is and isn't, and what a session of hypnotherapy might involve. And I promise I'll hold off on the bird sounds. As the name implies, hypnotherapy is a therapeutic technique that uses hypnosis. So, what's hypnosis? Well, first off, here's what hypnosis is not. It's not something done to you. In other words, when I work with you using hypnotherapy, I won't hypnotize you. Instead, I'll help you hypnotize yourself and guide you through the process. So, what is hypnosis? Although there is no universally accepted definition, the word hypnosis is generally used for a mental state of enhanced focus, also known as trance, during which you can concentrate on particular things and block out distractions much more effectively than in usual waking consciousness. Everyone experiences trance, though you might not have called it that. If you've ever been absorbed in a book or a game or a conversation and lost track of time, you've been in trance. If you've ever driven somewhere while thinking about something else and then arrived at your destination and realized you don't remember getting there, you've experienced trance. So hypnosis, or trance, is a common phenomenon. You've already experienced it in one form or another. What happens in hypnotherapy is that you'll learn to induce and deepen your trance state with your therapist's guidance, and use it to help you with whatever you're working on. While people vary in their ability to experience hypnosis, research shows that about 90% of people score high or medium on standard scales of hypnotizability. Curiously, the apparent depth of the trance you experience is not necessarily related to the effectiveness of the therapy. In other words, people often benefit from hypnotherapy even when they don't seem to be in a deep trance. So, what happens in hypnotherapy? Before doing any hypnosis, your therapist should interview you about what you'd like to work on and get some history from you to make sure hypnotherapy is appropriate for your situation. This is one of the main reasons to use a licensed psychotherapist, such as a psychologist, psychiatrist, psychiatric nurse practitioner, clinical social worker, or a licensed mental health counselor for hypnotherapy. A trained, licensed psychotherapist uses hypnotherapy as one of the tools in the toolkit and is equipped to handle whatever arises. A thorough assessment may take a session or more before you do any formal hypnosis work, though if you have enough time available, you can sometimes begin hypnosis work in the first session. When you begin the hypnosis, your therapist will guide you as you enter and deepen a trance state, and then work with you to develop and strengthen your own abilities to solve the problems you're working on. Most people remain fully conscious throughout the hypnotic session, though you may feel very relaxed. One of the more curious phenomena you may experience is that your unconscious may respond to suggestion in a way that feels automatic to your conscious mind. For example, your therapist may suggest that your unconscious communicate by, say, raising your arm, and it may seem to you as if your arm were going up by itself. This may feel odd, but it's still you communicating. It just shows how much of what we do is happening at an unconscious level. Well, if that can happen, what about clucking like a chicken? Can the therapist get you to do something silly? And what about those stage hypnotists who get people to do all kinds of things like that? Simply put, you won't do anything silly in hypnotherapy. First of all, your therapist won't suggest it, and second of all, you wouldn't do it even if they did suggest it. The people who end up doing silly things with stage hypnotists are precisely the people who want to go on stage and be a good sport. The stage hypnotists make sure of that by how they select their participants. People won't do anything in hypnosis they aren't okay with doing consciously. So no chicken clucking or duck quacking or other ridiculous stuff as part of a hypnotherapy session. Sorry about that. You can always do it yourself. Feel free to try it now. But only if you really want to. I'm Dr. Bruce Chalmer. Thanks for visiting.